Okay, so what we've been talking about in this first topic, which I hope is kind of clear despite all this terminology and stuff, is that the old lens in which we have been looking at high-risk substance use and whatnot really breaks down prevention-wise by simply giving knowledge that doesn't really resolve the issues within the individual's life that are pressuring them and giving them feedback about use. Plus the fact that, a substance use can provide uh, relief, if we want to put it in that terms, um, to the individual. So we've got to start looking at it through, and we've termed this the EM islands, ecological, meaning the person's environment, the person's social situation, and the like, and look at those systems and see what is the influences to the individual's drinking. So in the text, there's the study of Jordan, who's a 16-year-old who drinks with friends in the weekend. But if we just stop at Jordan, stop drinking with those kids, we miss a lot of points in the case study that is presented, in that we miss things like his home pressure, the lack of resources at the school, and the pressure he feels like that. So if we just say, don't do it, it's bad for you, we're missing out on a huge area of what really is driving the behavior itself. Things such as belonging, feeling a lack of belonging because, again, lack of school resources and availability of after school programs, those kinds of things. He's experiencing something we call cross pressure. He's a caregiver at home. There's complaints at school, and he's feeling the pressure to be mature with this peer group that has accepted him. Okay. And what it really comes down to is this kind of benefit cost analysis. And this isn't necessarily done on a rational level. This is this idea of refusal of friendships, rides, and status with a group where he's has these pressures at home, these pressures at school, and the substance also is providing some type of relief from that. So what we hope to look at when we're really looking at prevention is a multi-level response. Brief indicated interventions, supportive referrals, school provides transportation, peer-led activities. And I know this is a perfect world scenario if we could provide all these things. And that is the difficulty behind trying to really build a comprehensive prevention program, is it becomes politically sized, it becomes turf wars between different organizations trying to intervene, like the school and a community advocacy groups and legal systems. All of them have turf wars. So in reality, I just want to mention that this is a perfect world of what we could establish for a person, but it's worth looking at. So when it comes down to it, we need to look at what are known as the 9 principles of an ecologically grounded prevention program. And since over the last two sessions, we've gone over these in detail, I'm just going to kind of read them off so that we're aware of them. One is we need to begin with local knowledge. We need to use the live experience and not just import a canned program. Two, we need to match the developmental period that the individual is in. For example, it was mentioned in last sessions about adults versus youth. Those programs will look very different, not only based on a person who is in work and career, an older person, or someone who's in school, but the fact that they're both in two different developmental periods in their life. Three is that good prevention needs to address multiple levels, changes in relationships, policy, and access. The fourth one is building protection, not just fear. So dependable relationships matter and use of awareness. And fifth is the avoidance of stigma. This is doing that the person is using substance because they can't control themselves, or stigmatizing the drinking behavior itself, assuming it's a disposition of the person. Six is we need to preserve dignity. And maybe the punishment model isn't the way we should head, but in producing inclusiveness destroys protective connections. And then seven, reduce those ecological costs, ensuring healthier choices, and focus on this term, have realistic pathways to belonging, okay? And then co-design with the community. I mentioned those turf wars, right? Is intervention must resonate culturally to succeed. So you have to really focus on those grassroots of the community to really resonate across the community and organizations. And practice cultural humility, balancing research evidence with practitioner judgment and local realities, okay? Again, it goes back to the example I believe I did in this class about mental health treatment that's not culturally appropriate given the culture that are more community-based versus individual-based.